the long holiday weekend ahead of us and spending more time outdoors in the heat and humidity, it's important to remember how to take care of yourself and also your loved ones. So Dr. David Winter of Baylor Scott & White Health is here with all the things we need to keep in mind and on hand so that we can be prepared for this heat, because it's not going anywhere anytime soon. Good morning to you, Dr. Winter.
Good to be here. Good to be with you.
So glad to have you. Okay, so tell me, what kind of heat is considered extreme and maybe even unhealthy for us?
It's not just the temperature, it's the humidity. So the way our body's cool, moisture on the skin, that'll cool your body. So if the humidity is high, it doesn't clear it very well. So moisture is important. Humidity high, that's a problem. No wind, that's a problem. So any temperature 80s, 90s or above, you got to have low humidity and some kind of breeze to really cool your body down.
My goodness, which we're very used to. We're very used to those triple digits. So even maybe adjusting our schedules to maybe go outside at a different time would be helpful instead of staying out there when the humidity is high, when the heat is high, and obviously when there's no wind happening. So who is most susceptible, do you think, to these heat-related illnesses? Heat stroke, exhaustion, all the things?
Yeah, the young kids, the old folks, and people that take medication. So if you're taking antidepressants, antihistamines, decongestants, if you're taking Parkinson medicines, a whole list of medicines can also lower your chance of cooling down.
Right.
So with that, drink lots of water. That's the key.
So you almost need to be intaking more water, especially if you're on medication, making sure that you're upping. Maybe you can even get a cool water bottle and track it throughout the day. Let's talk about heat-related illnesses a bit more. Let's just dive in more. So for heat cramps, I know not everybody gets those, but they do exist. How do we treat those?
That's the first sign that you may be getting dehydrated. You may not be thirsty. Usually you are, but you may not be. So with heat cramps, typically in the stomach, or in the legs, start drinking lots of water. That's an early sign that you're starting to get into trouble.
Interesting. Okay, and what about heat exhaustion?
Well, with that, you start sweating profusely, a lot of sweating. You get lightheaded, you have pale skin, you may have some nausea, vomiting. Those things will are a clue that that's getting even worse with heat-related illnesses.
Got it. So it's almost like a domino effect. As certain things happen, other things start to come into play, such as the exhaustion. Got it. Okay, so what about heat stroke? Because I'm assuming that would be the next domino after that.
That's the next level. If you got that, you're in big trouble. With that, the sweating starts to slow down, even stop. That's scary. When you start to have no sweating, that's a problem. Your skin will get flushed. You'll feel really confused, sometimes very, very weak. That needs to be treated very quickly, or not, you need to seek medical attention.
Got it. Okay, so at this point, we do not go home and try and fix it ourselves. We go straight to the hospital at that point.
Start drinking water. If it doesn't go away quickly, then yeah, you need to see somebody about that.
Got it. Okay, and I like that you said to be wary of not sweating, because I think a lot of the times we point directly to that. We're looking to see if we're overheating by how much we're perspirating, but if we're not perspirating at all, that means we run out of hydration within our body.
When you're sweating, your system's working. When you stop sweating, that's a problem. Your body's going into shutdown.
Interesting. Okay, so how can we minimize this risk? I mean, is it clothing? Is it hydration? I know you just mentioned drinking more water. Yeah,
drink lots of water. If you're out there for a prolonged period of time and you're sweating, think about all that sweat needs to be replaced with water. If you're drinking lots of water, you could add the electrolyte solutions. Those work, the sports drinks. Now, when you do that, I like to have one of those and the same amount of water. Go alternate, just not sports drinks. You need a lot of water with that also.
Interesting.
That can make a difference. And you want to wear light colored clothing. Fits kind of loosely so you can have some movement of air around you. That will make a difference.
You just mentioned sports drinks and just energy drinks in general. Are they healthy? Is it something we should be partaking in? Can we have a Red Bull and then go outside? Would that hurt us in any way?
Now the caffeine drinks, which Red Bull has a lot in, those are not really good. That can actually work against you there.
Right.
But sports drinks with electrolytes, those can help. But not all the time. I don't drink just those. I drink those and then a glass of water and then go back and forth.
So dilute it almost in a way.
All right.
Yeah. Okay, so let's talk about, I know we're talking about heat exhaustion, but there's tons of things going on in the world that we want to know about and need an update on. And so if you could, can we talk a little bit more about the measles? Any update there just as far as the spread? I know we heard about a couple of cases here in Texas. What can you tell us about that?
Yeah, measles is still out there and it's going to be out there. You know, measles was gone in this country in the year 2000. It's a shame it's come back, and it's come back because we're not vaccinating the kids. So if you've had measles or if you had a vaccine, you are perfectly fine.
Okay.
It's a lifetime protection. But if you've not had that, now if you were born before 1957, all those folks are immune. But if you're if you're younger than that and you haven't had a vaccine or the measles, you're vulnerable. It's the most contagious virus on the planet. So if somebody walks by you and you haven't been vaccinated, if you hadn't had the measles, you're likely to get it.
So it's very easy to pick up. It's literally just a swipe of literally walking past someone.
And very easy to prevent. That's the key. The vaccines work very, very well.
So easy to pick up, but also easy to prevent as well. Okay, so you just got to pick which end you want to be on at that point. What about the West Nile virus? I haven't heard a ton about it, but I know that it is going around.
It's a rare virus, but it happens in Texas. In fact, there were about a dozen last year. It comes from mosquitoes. And it can be really, really bad. A patient of mine last year was in the hospital ICU in a coma for 3 weeks.
My goodness.
Now, he survived, but it's better to prevent that. And you get it from mosquitoes. So if you're out early morning, late evening, that's when mosquitoes are active, use the repellents. DEET, permethrin, both those work very well. But be careful about mosquitoes because West Nile virus can be deadly.
It can be very serious, and on top of that, you're right. Our landscape and what we live in is so prone to mosquitoes. I mean, they are everywhere, and so it seems like you can almost get away from them. So
standing water in your yard, get rid of standing water. Early morning, late evening, that's when mosquitoes are active. Be careful.
Be careful indeed. Thank you so much, Dr. Winter, for being here
Always
this morning,
good to be with you.
Clearing up some heat questions.